So thank you, everyone. The semester is coming to an end, but our brown bag is going strong. I think we're going to be switching at some point to every other week, but we have been doing this weekly. So keep an eye on your announcements. Not quite sure whether we're doing one next week or the week after, so you'll see about that. Usually I don't do pre-announcements, but I remember very fondly a reception we did in our billiard room, that's also known as the tea room, for Luis when he was elected as a corresponding member of the United States National Academy. And so I thought I would use that memory to ask everybody to join in applauding Ted for having recently been elected to the American Academy of Arts and Sciences. So bravo, Ted.
Thank you. Thank you.
Okay, and so with that, we're going to have two talks today. Our first is by Berkeley's own Ted Miguel, and he'll talk about the economic impacts of, also our broad theme is the epidemic outside the United States. And Ted will talk first about some of his work in Kenya and about the economic impacts of the epidemic. And then Luis is going to, I think, put on more of a demographic hat and talk some about the estimates of infection rates and mortality. Am I getting this right, Luis? Infection rates and mortality in Latin America. So with that, we're going to do about 25 minutes for each. So each speaker will speak for about 10 minutes. Use the chat room, please, actively. I'll gather questions from that to ask. And also, we've had our speakers, sometimes our speakers have been kind enough to give us a kind of annotated transcript of questions they weren't able to answer that we post on the DMOG blog. So that's another fun thing. So you can look on dmogblog.org if you want to see past transcripts. Okay, so with that no introduction, take it away, Ted.
Great, thanks so much for having me. It's great to see you guys. It's been such a strange time being away from campus and colleagues, so it's really nice to connect with you guys virtually. I'm going to present some new data today and a little bit of discussion about what we're learning about economic impacts of the crisis in Kenya. And this is joint work with several co-authors, Dennis Edgar and Michael Walker, who are here at Berkeley, and then Johannes Haushofer at Princeton. So again, just a little bit of background. I think everybody knows about the COVID crisis and the effects it's having here. There's also tremendous interest in what it's doing in low and middle income countries, but less data in many cases to help us understand the economic and social consequences of the crisis, particularly in African countries where data collection systems aren't as robust. There's a lot of concern about not just the crisis, but the response to the crisis in poor countries. And I guess you guys have been following some of that discussion, you know, in the newspaper, on Twitter, et cetera. You know, is the cure worse than the disease? Many African countries have large shares of population living on only a few dollars a day. So lockdowns and social distancing can be extremely challenging for people who don't have savings. Many people are at risk of food insecurity. But again, we don't really have very detailed data yet, or it's just beginning to emerge about how the crisis is affecting African households. The flip side of all of this on the demographic side is that African populations tend to be very young, and you know, with median ages between 15 to 20 years in most cases. So that's, you know, provides some, you know, less risk and sort of less exposure on some level to COVID disease. And another upside is many African households rely on subsistence agriculture. So, you know, maybe they're going to be a little bit more resilient to these lockdowns. Anyhow, those are just some background. This is a photo that was taken by the AP of a Kenyan in a town who's wearing a face mask. And I'll actually show you data on face mask wearing in a little bit. But this is just going to change our behavior. Next slide is just a very timeline. I won't get into it in a lot of detail other than the first cases of COVID-19 were detected in Kenya in mid-March. Within about a week, there was a lockdown, and a lot of the sort of characteristics of the lockdowns are very similar to what we've experienced. First banning large gatherings, then closing schools, you know, restrictions in terms of air travel, A curfew was imposed nationwide in late March. And then over the next couple weeks, there were more and more restrictions about in terms of population movements in and out of large cities and certain counties. So in many ways, this is a more severe lockdown than our own, because even driving in and out of Nairobi requires some sort of letter, or if you're a truck driver bringing food, that's okay, but you or I couldn't necessarily just drive a private vehicle. What's ended up happening in terms of the sort of media reaction to all this and the popular reaction is tremendous concern in Kenya about economic consequences, people who can't eat, who can't earn money. And so there's already been some pullback starting on April 27th, where certain types of businesses like restaurants are now allowed to operate. And the kind of rumor among our colleagues, and there's been some discussion in the media, is maybe even in June, there'll be reopening of schools. So Kenya experienced this like pretty severe lockdown within a week or two of detecting cases. It lasted for about a month, and now they're kind of pulling out of it. So we're going to try to study what happened during that period of lockdown. What we did, and the sort of data I'm going to quickly present today, and this is new data. Like some of this data was collected like 3 days ago, and this is brand new. So I'm really excited to get your guys' reactions. When the lockdown started, we stopped all of our in-person data collection, but we had several field teams in place to collect household surveys where we're measuring economic impacts of various earlier interventions, and we transitioned our teams to doing phone surveys of these samples. And I'm going to talk about one sample in particular where we started the data collection first. It's a sample of households, a representative sample of households in Siaya County in Western Kenya. And the sample is part of a multi-year RCT providing cash transfers to households. Those transfers ended several years ago, but we're putting in place sort of follow-up data collection over the last 5 or 6 years. So what we did is we started phoning these folks, and every week taking a random subset of households to collect data on. We started the first week of April. So we're sort of starting right after the lockdown started. And so it worked to our advantage that the vast majority of households have phones, so we're able to contact them. And we get a response rate over this month, about 3/4 of households answering the phone when we call them. So that was great. Part of the reason why we didn't start immediately in late March is we went through all the CPHS and human subjects approvals, both in Berkeley and in Kenya. And so we have those secured, and we started collecting data. We're actually happy that was pretty quick in this case. We also are lucky to have longitudinal data here because we can compare the data we have here to pre-COVID income and consumption. Now, we haven't made the data fully comparable and dealt with like price inflation yet, so I'm just going to show you the data for April, but in the future, we're going to be able to do that. And so the main question I'm going to ask is like, what happened in this pretty typical rural area, typical in terms of income levels and education levels in rural Kenya during the month of the lockdown? In the future, we also want to try to understand heterogeneity, who was affected, how much, and why. But for now, I'm just going to give you the overall averages to start. So this is a map of the study area in Siaya. It's near the border with Uganda. It's on a major road to Nairobi. And we have something like 90% of villages in this whole county in our sample. So we try to be very comprehensive in terms of coverage, because for the previous work we did, we tried to measure GDP for this whole local economy. So we put in place data to measure consumption, income, revenue, et cetera, to come up with a sort of income measure for the area, like a GDP measure. And I'm going to show you a kind of approximation of that measure today to say what happened during the lockdown.
Ted, you can also use your mouse if you want to point out anything to us. We can see it on the screen.
Oh, good. Okay, I will. Thank you. Okay, measuring living standards are hard. Let me not get into this. This is just a slide saying, measuring living standards are hard, but we've learned tricks through the years in development economics, asking about informal as well as formal employment, subsistence agriculture, as well as crop sales, to try to measure economic activity broadly. And we're going to kind of show you that broad measure here. If you have questions, definitely bring them up in the Q&A about how exactly we constructed these things, but it's pretty standard based on World Bank LSMS surveys. Okay, so what's the result? And I'll just take 5 minutes to kind of show you the headline numbers. over the course of April, we did 4 representative snapshots, 1 each week, and measured total household earnings, total household consumption. And the headline number, if you take one number away from my 15 minutes here, it should be that we estimate that from early April to the end of April, household earnings fell by 26% among households in this area, this representative snapshot in the area. So it's a very large shock. Now, it could be that the drop is even larger because the lockdown started like a week earlier than we started collecting data. So maybe this is probably an underestimate of effects, but it's a very large effect. Now, consumption, when we measure what people are actually eating, literally eating or buying, that falls by about 15%. That falls less because we have evidence that households are selling assets and taking loans, they're dissaving, in order to deal with the income shock. This is exactly what we would expect them to do. They're trying to smooth consumption. They're only able to partially do that too, because most of these poor rural households don't have tons of savings to draw on, but they're drawing on what they have. So again, this is based on about 4,000 households to date. In the future, we're going to get into comparing to the earlier data. We're also very interested in studying whether people who had earlier received a cash transfer are more resilient during this period. We know that when they got the cash transfer, they invested some of that in assets and investments. Are they better able to deal with this shock? We'll study that in the future. We're actually about to register a pre-analysis plan. We haven't looked at that earlier treatment and control data yet because we want to register the pre-analysis plan first. So we find loss of employment, we find a rise in food insecurity, and then I'll also show you some data about COVID awareness. I'm just going to show you 4 or 5 tables and figures with the summary results, and then I'll try to wrap up. One thing I want to mention now, though, before I get to it is we don't find very much evidence of social distancing, even though the government tried to impose those practices. In week 2 of our data, we do find a dip in the number of people that our sample was interacting with. We find some changes in behavior, but by week 4, behavior had gone back to week 1. So it doesn't really feel like the lockdown is necessarily doing much in terms of restricting contact, but we do find some other changes in behavior. So let me very quickly show you these. I'm not going to get into all these. These are all of our income categories. Look at the bottom row. Per capita consumption, this is per capita income in the last 14 days. And if you compare column 1 to column 4, you can see a drop of 26%. 455 to 336. That's our kind of measure, and it's sort of dropping every week. Every week that goes by, households are earning less in our data. Okay, so that's our kind of main number here. We add up wage employment, self-employed earnings, agricultural earnings, and transfers as income. And then we have that separate dissaving row there, and you can see dissavings really goes up in weeks 2, 3, and 4.
Can you point for us, Ted, just to help us along? Just point to where you're talking about.
Oh yeah, sorry about that. Yeah. So let me bring the cursor over here. So, oops. Yeah, so dissaving is right here. Can you see the little hand? Yeah, so dissaving is here. And you can see from week 1 to week 2 and 3, it goes up a lot. And then maybe dips a little bit in week 4. Even though income is low, our interpretation is by this point, households are running out of assets to sell. So maybe dissaving is falling there. The total household income in this bottom row goes from 455 in week 1 down to 336. So that's the big drop. Okay. This is the same data graphically. Oh, sorry for all the lines. Those are all the components of income. The solid purple is total income. You can see it. You can see it falling, while the green line of dissavings goes up a lot. So that's the kind of offsetting effect there. And again, in the future, we're going to be able to compare this to the earlier rounds of data once we appropriately deflate everything. We also have consumption. So let's just focus again on the bottom row. We have different elements of consumption, food and non-food. From week 1 to week 4, we see this decline in consumption. The decline in consumption really kicks in at the end. So again, all that dissaving seemed like it was dampening the decline in consumption in weeks 2 and 3. But by week 4, when the dissaving slows down, consumption starts falling. So income fell, people are running out of assets to sell, consumption falls. That's our best interpretation of this.
What is in parentheses, Ted?
The parentheses here is the standard deviation of this mean. So this is the mean level. And you can see there's a lot of variation in consumption levels, for instance. So there's some very poor households and wealthier households, really pointing to the fact that, when we have a few days to work on this, we're going to want to look at heterogeneity, but I'm just showing you the means now.
Thank you.
Okay, so this is the same figure. You can see consumption's pretty stable, but then by week 3 and 4 starts really tailing off here. So if these lockdowns continue, it's not really too surprising to us that the Kenyan government around week 4 in our data started pulling back the restrictions. At least in our data, consumption really started falling that week. And that's when they started easing up some of the restrictions. Okay, again, very quickly, I've put a box around these here. We're finding that this reduction in consumption shows up in people skipping meals. So the number of days in the last 7 days where adults and children have skipped meals, both increase, and you can see that here, especially for kids. So it was an average of about 0.7 days a week where kids had to skip meals in week 1. It goes up to, it almost doubles by week 4. So there's certainly there's certainly, food insecurity is becoming severe by week 4 of the lockdown in a rural Kenyan setting. Let me switch to we're finding that over time, weeks 1 to 4, the number of symptoms people can mention goes up a lot. The number of prevention measures they're able to name goes up a lot. So there seems to be greater awareness of COVID. I didn't put up a variable we have you heard of COVID-19? Because even in week 1, it was 100%. So everybody knew about it. But objective knowledge is rising. So that's a kind of useful thing to know. What isn't changing so much, though, is in-person interactions. We asked, how many people did you have face-to-face interactions with in the last 7 days? In week 1, it was about 8 people on average. And again, week 1 was already in the lockdown, so we don't know what it was in February or March. By week 2, there's some reduction to like 6.7, but then it just kind of goes back up. So the attempt to really have a severe lockdown didn't seem to work. And there's kind of similar data for interactions in the last 14 days. So again, Kenya is sort of loosening up. And I will say, and I'll give you a couple anecdotes here before I wrap up. I only have 1 or 2 more slides. We heard in these first couple weeks of April, the government was really cracking down. They were trying to shut markets where people were selling goods. They were tear gassing markets in this part of Kenya to try to keep people out of the markets. By late April, a lot of markets have reopened. There is some police presence. People are being asked to wash hands and wear masks in the markets, but they've already moved away from like the really severe lockdown. It just wasn't tenable in this setting. Okay, one place where we do see behavioral change, even though social interactions aren't changing, is in face masks. So in the beginning of April, about 10% of people had been wearing face masks. By the end of April, it was almost 60%, with a pretty steep trend. So there has been behavioral change, and this is positive sort of public health behavioral change, limiting infection risk for others. And it feels like this is how Kenyan society, at least in Western Kenya, is dealing with COVID. Markets are opening up again. The claim is maybe even next month schools will open up again. The severe lockdown is being eased, but there is some behavioral change that's positive to reduce infection in terms of wearing face masks. Okay, last slide, and then I'll conclude. And I think I'm just about close to time. Maybe I'm a few minutes over. Sorry about that. One thing that we're seeing is there's a lot of education going on for kids. In the last day, about 70% of kids are doing some educational activity at home, and even about a quarter of kids are going to some schooling. And this, again, goes along with the anecdotes we're hearing from our field team, that they're seeing kids with the knapsacks either going to schools themselves and teachers holding classes even though they're not supposed to, or going to tutoring sessions. So again, the lockdown hasn't been enforced that seriously. This is my last slide. This is the first bit of data we've collected, but we're going to start collecting similar surveys, or we've already started with multiple other samples for other projects I'm working on, as well as a nationwide representative sample with World Bank support and coordination with the Kenyan Bureau of Statistics. We're going to have about 25,000 households in all. In the next week or two, we're collecting this data on to try to understand what's going on in the COVID situation. And then our plan is to share it very quickly with policymakers. We already have a website. We hope to go live in the next couple of days. And I just want to leave with this question about like what's going to happen in the next month if these partial lockdowns continue. What's going to happen to poverty and hunger In Kenya, I think there's a lot of open data, open questions. We don't have enough data, but I'm very concerned that the kinds of extended multi-month, multi-year, lockdowns that we're talking about, happening maybe in the US or rich countries just wouldn't work in rural Kenya and could do a lot of harm, as we're seeing with the food insecurity results here. Okay, so I spoke way too fast and maybe covered too much, but let me just leave it there. I don't know if there's any questions.
There are chat questions. I wasn't gonna, and you should know that your colleague David Eggers has been a great job or Dennis, excuse me, has been done a great job at fielding questions.
Oh, I haven't had the chat box up. Sorry about that.
No, you can look at it while Luis is talking, so that would be good.
Okay.
Yeah, let me see if there's any. Yeah, Dennis has been answering most of the questions. So I think, why don't we, I don't know what happened to Josh, but perhaps what we should do is just sort of move to having, unless anyone has any questions they want to ask that weren't in the chat. See, Josh is trying to connect to audio. We could just move to Luis. Any questions?
Thanks, everybody.
All right, so Luis, you can start sharing. You are on.
So how are I doing?
Looks good.
Okay, thank you. I am going to present a preliminary analysis of data available in the web that suggests that COVID-19 pandemic is being less severe in Latin American countries. I am going to use two indicators of the pandemic. One of the severity of the pandemic, and I will use a death ratio, the cumulative number of deaths at day T, divided between the elderly population. In this way, I am trying to introduce some kind of control of population aging. And for the dynamics of the pandemic, I will use an estimate of the reproductive number, our well-known net reproduction rate, which I am estimating under the assumption that the recovery rate is constant over time and the mean infectious time is 14 days. So let's present the results for these two indicators. Regarding the death ratio, I am showing here the data for 16 Latin American countries, and to put things in context, for 5 more countries. 3 countries with very high, well-known, very high levels of mortality, the state of New York, Spain, and Italy. And at the other extreme, Taiwan, which is an extraordinary success of a lower level of this pandemic. And in the middle is also the state of Florida, which I am including because it has in some ways a kind of warm weather similar to Latin American countries. Well, it seems clear. Oh, please notice that the scale is proportional or logarithmic, and also that all the countries were measured at the 45th day of the epidemic. And it seems clear that Latin American countries fall in between the two extremes of the very bad situation of New York, Spain, or Italy, and the very nice situation of Taiwan. And within Latin American countries, there is a lot of variation. There are 3 countries with very high levels of mortality, very severe epidemic. These are Panama, the Dominican Republic, and Ecuador. Ecuador has received a lot of publicity in the news because of all those dead bodies on the streets of Guayaquil. But you can see that Panama and also the Dominican Republic have those levels of mortality. Of course, in these countries, it has been said that the number of real of COVID deaths are several times higher. In Guayaquil, there are estimates that the number of deaths are 2 or 3 times higher. But even with those numbers, the severity of the infection of the epidemic is not as high as in Italy, Spain, or New York. And it's important for me to notice that at the lower level of death ratio, there are countries well known because they have reliable data. Especially I am thinking on Cuba, Uruguay, and Costa Rica. So it seems real to me that for a bunch of Latin American countries, the severity of the epidemic has been very low. Say like 100 lower than in Spain, Italy, of the state of New York. Okay. The same data now comparing 4 groups or regions, 4 groups of countries or regions. The United States, Europe, excluding Eastern Europe, the 16 Latin American countries. And by the way, I am excluding 4 Latin American countries with not reliable data. And the success case of the East and Southeastern Asian countries, excluding China, which is a special case. Okay, it is clear that by the 45th day of the epidemic, Latin American countries have lower death ratios in the population than the United States or Western Europe. Let's talk now about the dynamics of the epidemic with our well-known reproductive rate. And I am presenting data at 3 times of the epidemic. At the end of week 1, then week 3, and the most recent week, number 6. The data for the first week of the epidemic is very important, especially for epidemiologists, because it provides an idea of what they call the R0 or the R0, which is kind of the natural level of the transmission rate of this disease. And you can see that most Latin American countries fall between 2 and 3 reproductive number. And this number is lower than those numbers observed in US states and in Europe. But it's higher than the numbers in East and Southeast Asia. By week 3, the numbers are similar in the 4 regions, and after 6 weeks, transmission seems faster in Latin America, but with a not so large reproductive number, maybe 1.2 or something like that as a median. So let's look now to the data to explain Latin American lower severity and slower initial transmission rate. We are going to look at the case fatality rate, which if it's very high, will indicate that there is severe undercount of cases. Then the testing rate, which is both an indicator of underdetection and undercount of cases, and also an indication of deficient contact tracing and the presence of an epidemic out of control. And finally, some data about social distancing behavior taken from Google. Let's see first the case fatality rate at 2 times, week 3 and week 6. And if we say that fatality rates over 3% are unbelievably high, and probably due to great undercount of the denominator. You can see that by week 3, very few Latin American countries were about those levels, but worrisomely at week 6, most Latin American countries are showing very high levels and unbelievable levels of fatality rate. So here there is some indication that part of the results we are observing are due to undercounts of deficiencies of the Latin American data. Regarding testing, there are very interesting results. I am presenting here the number of negative with respect to the positive cases. Contact tracing situation requires at least 10 negative tested individuals per positive. And you can see here that at the end of the first week of the epidemic, Latin America was in a very nice situation with 20 or more negative cases per positive, which says that the countries were doing very nicely containing and tracing of cases. I should mention that in this data, Brazil is not included because it does not provide testing data, official testing data. The first and the second week of the epidemic are critical for containment. If get out of control on those days, things turn very bad. And it looks like Latin America was doing fine in the first week. And after 6 weeks, most Latin Americans are still doing fine in this regard. And finally, regarding social interactions, I have taken the average of 3 indicators that Google provides, which is the number of cell phones contacts in 3 areas: trips to shopping, dining, and recreation places, trips to job places, and trips to transportation sites. These 3 are very highly correlated, and I just did an average of the 3. And you can see that Latin American countries are doing substantially better than Europe and the US, and also better than Asia. And it seems like Asia didn't really use social distance to control the epidemic. And that was true at the end of week 2, and is especially true by week 4, in which the amount of social interactions is as a median less than 30% that used to be previous to the epidemic in Latin America. And I'm sorry. Well, to finish, in conclusion, indeed, it seems that the pandemic, it has been milder in Latin America than in Europe and the US so far, at least. There are some indications of deficient data in some Latin American countries. And there is some evidence that transmissions was slower in Latin America in early weeks, as measured by the R0. Some explanation of that could be warmer weather, lower density of the population, and some people are talking also about innate immunology because the high coverage of the BCG and polio vaccine. And what I believe what really happened in those first days in most Latin American countries was that there was a very high level of testing, and also, as data shows, social distancing. There are higher contact tracing in Latin American countries, especially in the critical initial weeks. And I think that is in part a result of nice networks of public primary healthcare facilities in many of our countries. And also it played a role, the experience that our ministries of health had with dealing with recent epidemics of dengue, Zika, malaria, and so on. And it seems that in Latin America, there has been a more effective changing on social distancing behavior. Thank you.
Thank you so much, Luis. I'm back. Apologies for missing the discussion, but I'm sure it went fantastically with Ted. Okay, we're getting a number of questions. Let me start with a question from Will about when will all-cause mortality be available in Latin America? Is there some country to keep an eye on that is going to release data relatively quickly?
Well, I don't know in other countries. In Costa Rica, we don't have this data until the end of the year. I mean, the institutes collecting those data don't provide it before that. I have seen data about that in Guayaquil and in Ecuador.
Thank you. And I'm getting a note from Anne saying that you guys didn't discuss Ted's talk, but unfortunately my screen is not showing the earlier messages. So I'm going to need someone else, maybe Will Dow can take over discussion of that. So we'll ask a couple more questions of Luis and then go back to Ted. So I'll ask a question I had myself. Do we believe the Google phone data for Latin America? Do we think that people were social distancing much more than, say, has been the case recently in North America?
Yeah, it looks like, yeah.
Sorry?
Yes, it looks like, yes.
But I mean, are there, if we were to go on the streets in a Latin American city, would we see, would things be tangibly different, or do we think this is different cell phone penetration and different habits that people have anyway?
Oh, I see your question. Well, the penetration of cell phones in Latin America is very, very high. And as I understand, Google measured not just automobile trips, but also walking trips.
Great. Okay, we have a question from Bernardo.
Josh, can I piggyback on that question for a second? Because there was one related to the Kenyan data of whether it was possible to use the household data that Ted just collected to try to look at the accuracy of the Google phone data. So do you have Google phone data for this particular county that you can try to use as a comparison, Ted?
We haven't tried to grab it, but it's a good idea. I mean, I think it's a good idea. We haven't done it yet. It'd be interesting to compare, for instance, in that week when we found the decline in reported social interaction, if we found the decline in Google data, it would kind of validate those measures, I think. So thanks for that suggestion.
Great. And then we had a question for Bernardo about measuring deaths. Bernardo's saying that in Brazil, they're looking at acute respiratory syndrome deaths. It's kind of not all-cause mortality. Luis, do you know about this going on in other countries?
No, not really, sorry.
Okay.
Just a little bit Costa Rica, Central America, and perhaps Ecuador. Mm-hmm.
Great. Will, can I turn this over to you for questions on Ted's talk? Because I don't have them anymore on my screen. I apologize.
Yeah, so Ted's collaborators, Dennis Eggert, did a great job responding to most of the questions. I did see a couple maybe that I'll follow up on, and one was about whether you know anything about who the contacts are with. Do you know anything to the extent to which people are having contact with family members versus others?
Yeah, all these, the folks we counted as contacts, social contacts, are non-family members, meaning they're not living in the same household. They could still be relatives, though. So all of this is sort of outside the household. At a minimum, we know that. We're trying to add data. Now we're basically rolling out firm surveys with firm owners, proprietors, trying to understand where they're traveling, where they're selling, and then we're going to get some pretty, some more detailed data about exactly where they're going, but we don't have that yet.
Great, thank you. So I think most of the other questions that I see here were answered for Ted so far, unless other.
Can I ask the question I remember from
And-
Ron? Maybe it's already been answered, but about decline in quality of consumption versus calories.
Yeah,
Sorry.
so we do have a breakdown. We do have a breakdown of goods, not quite as detailed as our full consumption survey. We actually collected quite a number of items, so we're going to be able to get at some of that substitution. We haven't done it yet. To date, we've just been sort of adding them up to give you these aggregates, but we'll be able to get at some of that. I think that's a good point.
And another question for you, Ted, from Ann Swidler, whether you have data on religious services and whether people are still going to churches and mosques.
We don't yet, but Ann, it's such a great suggestion. As you know, I'm interested in this issue, so now I'm writing down that for the next waves, we should bring that in. We haven't, again, on the sort of people you've been in contact with, we didn't get a ton of detail about exactly what those interactions were. It was more just counting them up. But I really like the idea. It would be so quick to ask that question. So thank you for that.
We do have religious services. We just haven't asked them yet, or we haven't analyzed them yet. Mm-hmm.
Sorry.
Oh, Michael, did we add it at the end?
Yeah, we do have the religious services, but we haven't analyzed those yet. So we can go back and check those.
Okay. So my bad. We ended up adding it in, and we just haven't analyzed it. Thanks, Michael.
May I? There is an interesting question here. Where do seniors live in general? In their own homes or with adult children? Well, in Latin America, there are almost no nursing homes, and only about 10% of the elderly live by themselves, along with the spouse. So most seniors are well embedded in the society in Latin American countries.
Ted, did you have anything to say about Kenya in that regard?
Yeah, I mean, certainly in this sort of rural setting, seniors are living in multi-generational households overwhelmingly. There are some folks who are living alone if their kids or younger relatives move to cities. And there is a fair amount of that kind of migration to Nairobi or Kisumu or large cities. Just before this exercise, we had censused the whole area, the whole population in this area. So we can characterize that. We don't have it right now, but we can characterize the share of people over, say, age 60 or 65 and what their living arrangements are. So we have that data, we just haven't analyzed it in detail. I think it'll be an interesting thing to analyze, just given the importance, the vulnerability of the older population with COVID-19. Yeah, that's something that we can do more analysis on.
So I'm struck from listening to both talks how, I guess, relaxed and normal the talks seemed and the situation in the developing world. I mean, when we kind of can't sleep at night here, it's the next Great Depression, this type of stuff. Should we be worried about the developing world less than what's the situation here, or is it just that you guys are being very hands-on and so looking at the data and seeing things kind of at the early stages? These vulnerable populations, are they, kind of to address the question you raised at the beginning of your talk, Ted, are they relatively resilient because they're used to hardship and so this is just another hardship that they're going to be able to be resilient to? Or is it the story of we have 1 billion people who have gotten out of poverty and are going to go right back into it type of story? I'm asking big picture, kind of why I shouldn't sleep tonight.
I can maybe say a word about that, which is I'm relieved personally that the kind of tightest form of lockdowns are being reversed right now, frankly, just because I think we're seeing in our data that every week that went by, consumption was falling, food insecurity was rising, but it wasn't sustained. I think if it were sustained for another month, Josh, I think consequences could really be dire. at the same time, there's something to what you said. I mean, people are used to, a lot of folks who live in cities even or live in towns came from rural areas in Kenya. They still have family in rural areas. They're growing their own food. So there is an ability to like separate oneself from the market if markets are shut down and survive. And I think in a way that we couldn't. Like if we couldn't buy anything, like if Amazon shut down tomorrow and all the grocery stores, we'd be screwed. I think that rural Kenyans in that way are more resilient. One of the things we are going to get into though, since we know the characteristics of these households, we have panel data on them. Some of these consumption income declines may have been particularly large for certain subgroups. So, for instance, if for the poorest households in our sample, the consumption declines and income declines were even greater, then that's really tragic. I mean, it's the human cost of that is huge. So we just haven't been able to characterize all of it yet.
Is there a segment of the population that is basically doesn't own anything and that is working for wages from people who do own something, and that basically their wages were cut off during this time?
Oops. I lost you there, Josh, a little bit. I don't know if I froze or you froze. Sorry, you said there a segment working for wages and sort of
is there a segment of kind of poor people who are working for, say, small landowners or small cattle herd owners who are actually being paid in cash that were not being paid in cash during this time? Is that the kind of vulnerable group that owns nothing?
Yeah, it's a little different, honestly, than say a kind of rural South Asian or some rural Asian settings where there's this huge landless population. In rural Kenya, almost everybody has some sort of claim to land. And I think that does provide some sort of insurance. I think it's different in urban areas where you do have a lot of, day laborers, construction workers, casual laborers, domestic workers that really aren't making much and are very, working day to day. And I think those are the people who are kind of most severely affected by this. I think in rural areas, there was people are growing their own food and a lot of people have access to land. So, maybe what we're showing in rural Kenya isn't as bad as what would be the case in urban areas. Of course, we're rolling out these urban surveys now, and our hope is to try to characterize what's going on in urban areas as well.
May I say something?
Please.
I'd like to say that at the beginning of this thing, I was much more worried about the epidemic. But I've seen that the transmission rates have been substantially lower than one expected at the beginning. The reproductive number is well below 2, I think, in Latin American countries and other tropical countries. But still, there are some elements, some worrisome elements, and I would expect, I would wait a few weeks more to see if the epidemic is going to go out of control or not. So far, things are not that bad, at least in Latin America, and with some few exceptions.
Thank you. Okay, we're approaching 1 o'clock. I apologize for the technical difficulties, but let's thank both of our speakers. Thank you so much. I can clap because my mute is off. Super interesting, expanding our horizons off of our very US-centered work to date, or the look that people got in these brown bags. So thank you both. I'm gonna end the official session, but I'll keep everything open and we can ask, you can turn off your mute and ask questions of our speakers or of each other as long as we have energy. So thanks again to Ted and Luis, and thank you to the audience for all the questions, and also make sure to pose your questions now, turning off your mute and just interrupting if we didn't get to them. So thanks.
I'm also going to save the chat file, so we'll have that. And Ted and Luis, if it's okay we're recording this, so if it's okay to release it, let me know. And if it's not okay, let me know.
Definitely, that's great. Thanks, Leora. Yeah, I'm glad you guys have the chat file. If we could get a copy of that, that'd be great, because
Absolutely.
We'd love to get those questions.
Yeah, and you can even answer questions, and we've been posting those, as I've said before.
Yeah, Will, I just see Will's point here. I mean, if we're done with the session, I can just say that Will directly. That's a great question about are folks who have elderly household members more likely to wear masks or wear hands? We have that data. We know the household structure. We know the behaviors they've adopted. So I think that's a great, very specific, very important question related to transmission to the elderly. So thanks for that question.
Yeah, I mean, you've got really unique data to be able to look at that kind of thing that very few places have right now in the developing world.
Ted,
Oh yeah, Ron.
this is Ron. I don't recall, but I have two questions. One is, do you know if agricultural production has gone down in the area, or if it's all small farms, maybe things just go on as they were? And then related to that is supply lines continuing. I'm thinking of the urban areas, and as I think Josh was saying, the difference between rural and poor urban, and in what the consequences are.
Yeah, thanks for that. This is the planting season, and most people are farming on farmland that they live on. So in some way for our area, this isn't a bad time. Like, it'd be worse if you were trying to sell a lot and had to move around locally to local markets to sell. But if you're planting right now and you basically have your seed from last year, I know that seed shops stayed open. So as long as you can get seed, if you have to buy seed and fertilizer, you're planting on your own farm, this isn't a bad time to have this kind of lockdown in rural Kenya. In terms of what you said about sort of trade and whatnot, they never shut down, even though population movements between cities and rural areas were slowed down, they always allowed food shipments, truckers, like those folks had sort of credentials to travel around the country, even during, even a few weeks ago during the most severe lockdown. So they haven't sort of cut off that kind of economic activity, thankfully. But not much is being produced in rural Kenya right now because it's not a harvest season. So, so in that way, they're a little more insulated. If they had really locked down the country right at harvest and folks were trying to sell product and get good prices far away, then it could have been, I think, more adverse in terms of an income shock. Guys, thanks for all these questions. I really appreciate it. It's good to see all your faces, and hopefully can see you on campus soon, maybe in a couple months. Thanks, Ken, Will, Leo.
Thank you, Ted.
Thank you, Ted.
Good to meet you, Luis.
All right, so with the departure, we still have Luis here. So,
So Luis, I'm curious. I mean, you said you're not so worried right now, but you said that the data indicate that there's been very intense behavior change in terms of reduced going out, the social distancing. But how long do you think this can continue in these places?
Yeah, much more longer. And the Google data are actually start showing changes. I mean, reduction in social distancing. So, but I'm not sure about the importance of this factor. I mean, it's important. Probably there is a synergistic effect. But the key thing in the most successful Latin American countries has been the contact tracing work of the Ministry of Health, the units in the field.
so when you compare that to the United States, where we're not really doing this, is there something that we can learn? Sorry to think selfishly.
Definitely. I mean, what the data showed is that in the US was horrible, the situation. Perhaps that's because you don't have a strong public health care system, but the US were almost not doing testing in the first or 2 weeks of the pandemic in order to contain it.
Okay, on that cheerful note, I'm going to bring this session to an end. Thank you, everybody, for joining in. And I wish you, I think are we in reading period in at Berkeley? I think we are.
Yes.
Exams begin next week, so I wish everybody a smooth end of the semester, and see you all either next Wednesday or the week after. Thanks, everybody.